Okay. It's 4 o'clock, my hand's on, and I'll call the meeting to order. Was the meeting properly noticed?
Yes, it was.
Roll call.
All members are present.
On the agenda, I'd like to make a recommendation that we move the Veteran Service Department up on the agenda so that they can leave earlier in the meeting. I don't know what you think, if we want to put it up above the items listed for discussion and action, or right? Okay. Okay, we have a motion by there's second by Shelton to move up Veteran Service Report up under number 7. Any further discussion?
Yes. Instead of doing this every meeting, could we just move it there permanently?
That's what I'm asking for.
Oh, that's what, okay.
Okay. Any further discussion? All in favor?
Aye.
Opposed? Motion carried. Approve the minutes of the May 12th meeting.
Second.
Motion by Grabarski, second by RPs. Any further discussion? All in favor?
Aye.
Aye.
Approved. Public participation we'll take as it comes up. Okay, that means we will now have the Veteran Service Report.
Veteran Service Report for May 2025. 39 client appointments, 6 outreach health and welfare checks, 532 phone calls and emails. Rick and I were both recertifying at a conference in Superior, Wisconsin for the week of May 4th through 9th. Very educational. And then we finished the veteran roof in need. That the grant through Juneau County that was approved, and it's all done and paid for, and his roof is completed now. So that was a process. We do our WDVA Zoom monthly for modernization and different things for the AMA. And we did all the flags for we got all the flags out to the different people. Yeah, the different people that put them out and everything. We were able to do that. Replaced a few bronze flag holders and missing ones, and did that in time for Memorial Day. And that was about it. And we provide excellent service to the veterans and their families, and community for elderly veterans, and awareness for veteran benefits. That's our goal.
Are there any questions? Supervisor Pease?
Have you seen any slowdown in money or anything else with the current what's going on in Washington with Doge and everything else, or was there no cuts to the veterans area?
We personally haven't seen anything. Our veterans are still getting it's standard denials, and then we turn around and appeal it and usually get it by fighting back. We're finding mistakes that are made by VA, and we just come back and fight it. That's all. But nothing with the VA itself. When we were in the conference, that was a big thing at our conference. They were talking about our liaison down in Milwaukee for VA was saying that there might be some changes, but we have yet to see anything. It's still business as usual.
Does it take any longer on that appeal process than it had in the past? Or is it still cumbersome sometimes?
Well, actually, with the new secretary of the VA, the process is sped up. His main goal is to support the veterans and their claims. So his first couple months in office, they processed over 1 million claims. So if that was under the old administration, it's just a big pushback where they're not doing the claims in a timely manner. So he came in and said, no, we need to do these. We need to do these claims and make sure they're accurate. So actually it's pushed the process faster. So
Okay,
Most of the problems in our filing are not with actual VA, but the third party that VA uses for their comp and pens. So when they do the comp and pen, if the comp and pen essentially is given 30 days to process the claim and, to get the veteran in and be seen, we're finding that on the 30th day, they email the veteran. And if the veteran doesn't respond within that 5-hour limit, they basically start the whole process over again. So we have to refile. So it's actually a third party problem. And we have been reporting that to VA on a regular basis.
okay. Are you hearing anything about cancellation of appointments at the VA hospital in primarily Madison? And people being told, well, sorry, but we don't have a provider, that you'll have to call back and see if you can make another appointment.
So are you talking about them going in for just a regular appointment, or, because there's two sides of the VA. You got your comp and pen side, and then you got the VA where they handle all the medical treatments. The VA, the comp and pen side is where we send all our claims in. They have to have a third party do the comp and pen side, and then once that's done, it goes over to the VA side and have a rater look at that, and then they rate the veteran. And if there's a conflict of interest there, then we have to, if they don't approve something and we go into DBQ and say, hey, there's an issue here, we have to do a higher level review, which pushes the claim another 125 days out. And then if the higher level reviewer says, no, I'm sticking with that, now we have to go to the Board of Veterans Appeals that now pushes it over a year. So there is no, I've not heard of any issues with, there's no providers in the VA side down in Madison. I'm not having any issues down there because that's where I doctor, and they opened up the East Clinic. So I don't know where these complaints are coming from.
Okay, excuse me, we're coming primarily from the VA side as far as follow-up appointments. They've been ongoing patients that follow-up appointments and they're not getting seen.
Yeah.
So apparently they're not complaining to you.
Yeah. The law, how the rule is written, the law is written is if the VA cannot see you within 30 days, it has to be community care outsourced. So if that's not happening and the veteran's not pushing for that to happen, that's on the veteran. If they don't want to go outside to community care. I find it a lot easier just to go outside community care to get my stuff done because it's done quicker. But if I have to wait 60 days, that's my choice to wait 60 days.
Yeah, they are given the right to go to community care. So they should just tell them that they want to go to community care, and then VA has to say yes.
Okay.
But they have to have permission. They just can't go.
Yeah, okay, thank you. Yeah, my other question is, on PTSD, how many instances in the county have you run into?
Like what kind of incidents?
Just patients with,
Oh, with PTSD?
yes,
Right off the top of my head, I don't know the total number we have for that. We just lost a veteran to suicide last week. Terry went up to support the widower at the funeral. So yeah, it's a tough place to be right now on that. So
We file a lot for it.
yeah,
okay.
but to give you an exact number, how many in the county have mental health issues, I couldn't tell you off the top of my head right now.
Okay, thank you very much. Does anyone else have any questions? Do you have any questions on their financial report? Seeing none. I guess we don't need a motion on anything, so thank you, gentlemen, and have a good rest of
Thank
your
you.
day.
You too. Thank you.
Thank you. And thank you for moving us up on the ladder.
Okay. We will move on to the public health annual report.
All right. I'm pretty sure most of you know me. I am the public health officer for the county. My name is Cody Przybylski. Every year I have to submit an annual report to the state. So Leanne, I'm just going to have you kind of scroll through on slides. I'll tell you when. That'll be a good one there. So currently public health has the highest credentials in the state with the level 3 health department. That is the max that you can get. And moving forward and with these reports, these are kind of the precedents I want to set with public health and my team moving forward. It just shows our commitment to always trying to do more and improve the county and the community. You keep sliding for me to our guiding framework. I just wanted to mention here that with our strategic plan, every year I try to do something different, whether it's flu vaccines, programming, or policies or protocols within the county. This is just my promise here that we're going to continue to grow programming, especially out of the COVID-19 pandemic. A lot of relationships were lost, so we spent a lot of years trying to build those relationships and programming back up, which you'll see as we go on through this annual report here. This will be a good one too. So our programs and services, this is just a snapshot of some of the work that public health does. In this annual report, you won't see all of our programming, but it is a good snapshot of everything that we do. Environmental health, we contract through Wood County, just because we have a small department. We do a lot of emergency planning with like thunderstorms, severe weather, cold weather, hot weather, heat stroke, things like that, all the way to community health, WIC services, which I'll hint on a bit here, communicable diseases, and then vaccine services. And if you do see the scan me part, that is a QR code. Every year, my team updates a comprehensive list of all the services and support groups in the entire county. It could be discount grocery stores. It could be churches that are doing support groups, things that Health and Human Services are doing. Every year this is updated, so anybody in the county or anyone in general can scan that and it'll show everything that's going on in the county for our services. For vaccines, as you can see back in 2021, just around the peak COVID era, we were doing flu vaccines at around 267 a year, and then they dipped down from 2022 to 2023. So last year I implemented a strategic plan for vaccines, everything from being on the radio to bag stuffers at grocery stores to media campaigns and billboards. We really tried to build that trust within the county and the community to get some preventions in with vaccines. So you can kind of see where it's starting to build up, and I hope for next year that we can continue to build on that where the numbers are a bit higher. So, and please stop me at any time if you have any questions. I wanted to talk about our community outreach measures as well too. Being a small health department in a really small rural county, we rely a lot on our key community stakeholders, partners, and I know I'd mentioned building relationships earlier. We were fortunate enough to build the relationship with O'Connell Pharmacy. They've been very crucial with our vaccination efforts in the county. As you can see, back in 2023, they helped us give over, let's see, I don't have the numbers in here, I can get that for you. But in 2023, we had over 150 vaccines that they helped us give. And then in 2024, it was just under 300. So just a key example of all the relationships that we try to build coming out of the pandemic and moving forward with public health. Also, we are part of the Narcan Direct program through Health and Human Services and the state, along with the fentanyl test strip program. So these are just more efforts that we're trying to do to aid in prevention in the county and the community. Childhood lead testing, when looking at the graph, you'll see spikes in 23 and 24. That is actually when WIC, Women, Infant, and Children, came back in the county. So in 21 and 22, and probably back in 2020, all WIC visits were done virtual. Back in 2023 in September, we brought them back. So that's where you might have questions like, why are there more lead cases? We're just able to screen more children that come through our doors here at Health and Human Services. Anyone that has a 3.5 or more elevated blood lead level, we have to do a visit with them. If it is over 3.5, then we schedule a home visit and do a lot of testing with Wood County Environmental Health, who will go into the home, check paint, or do a background check to see if maybe they came from a different county and got exposed with lead. Have you scroll. And this is what I was talking about a little bit earlier with WIC. I'll have you scroll down just a little bit more, right there. So last year they gave over 200 referrals. So that's pretty huge for being a rural county. So 200 children were seen and referrals that came through our doors. And this year they built off of those referrals. Their caseload right now is at 300. So I think for being a rural county, public health and WIC, we have an MOU with them within Juneau County, and they're doing a lot of screenings, dental services, fluoride varnish, a lot of ways to kind of implement prevention and health in the county and the community with the kiddos and the youngsters coming in through the doors and the new parents as well. Scroll down. So this may or may not be a surprise, but Lyme disease continues to be one of the most communicable diseases in our county. We're super rural. I know Lyme's and the ticks are really bad this year. As you can see, looking at the graphs, we no longer report COVID as a communicable disease. We only get those reports now when it comes through a hospital or a assisted living facility or a nursing home. That's the only way it's reported to public health now. Previously, if you would have looked at the 23 data from last year, you would probably see COVID in the 100 or the 200s. But now we're just reporting our main diseases, which is Lyme disease, flu-related hospitalizations, and then chlamydia. So those are our top 3 communicable diseases.
What about measles?
So yeah, measles is really prevalent right now in the southern states. We don't have any outbreaks in the county right now. There are a few in the states. We had a couple of hypotheticals, but they turned out negative, which is very good. So any other questions with communicable diseases or on that point? And then if you just pause right there, you may have seen this billboard on Highway 13 heading towards the town of Rome. But our public health team is always looking to kind of market communicable diseases and ways for them to kind of check for ticks since we're really prevalent. We also work with Land and Water to get tick signs posted. We're at farmers markets giving out tick kits, which help remove ticks or give information as well too. Lyme disease can be really, really bad. So our team tries to do our best to kind of give the education and outreach in the county. Animal bites, this is something new. We decided to post this year regarding the annual report just to kind of showcase. It could be from raccoons, bats, dogs, cats, other varieties of animals. Our caseload for nursing is pretty heavy throughout the summer months, especially with all the Airbnbs, cabins and rentals and vacationers coming up and visiting our county. Animal bites are very prevalent that come through. So I wanted to kind of showcase and show you guys what the numbers are for those. Child death reviews, there hasn't been any child death reviews in the past 6 years in the county. There have been child deaths. Just with COVID, we weren't able to kind of get this programming running. I worked with the state and our medical examiner, Marilyn, who just recently retired. We recertified Adams County as a child death review county. So we got that formalized. And then last year we did 6 child death case reviews. And I'm going to knock on wood here. We're all caught up now this year with child death reviews. For environmental health, the biggest thing, I'm going to have you scroll down just a little bit there, Lyanna, right there. So like I was mentioning, I have an MOU with Wood County just because our health department is small, but they do a lot of our contracted work for restaurants, mold inspections, house inspections. As you can see to the bottom right, you'll see the number 419 for lodging inspections. The town of Rome, 65% of that town is all Airbnbs and lodgings and cabin rentals. So that's where a big chunk of those numbers come. And then to your left for retail food inspections, you'll see 130. So a lot of their work is done between the Airbnbs, the cabin rentals, and then the food inspections. So with that, every year they do food inspections. If there's any complaints through a community member, we look upon those too. Any questions with environmental health? County beach testing. So public health is also in charge of doing all the beach testing in conjunction with Land and Water. Every 2 weeks from Memorial Day to Labor Day weekend, we test all of the county-owned beaches. We'll put out a media post and a press release if there is an advisory or closure to E. coli or blue-green algae. And then if you see the picture below, we kind of put out a post for the county. We always get phone calls for vacationers coming up wondering if the lakes are safe. So we like to put that out too.
One thing, excuse me, Supervisor Hick there.
Yeah, Cody, are all the beaches open right now?
Yes, they are all open and they were tested last week and everything is clear and ready for fun. So,
Okay, and I think your poster reads prom E. coli.
oh, from E. coli, it's just must be the font. So, yep, from E. coli and blue-green algae. We can change the font moving forward. So I'm sure you're not the only one that's had that question. So, any other questions with that slide?
Yeah, is Lake Sherwood gonna be included in that? I don't see it.
Yep, Lake Sherwood is included. It just wasn't on for that testing for that week. So, but we now have all the lakes tested on the same rotation every 2 weeks. And again, those are just for the county-owned beaches. Health promotion and community health, those are our two community health specialists. The biggest new programming that we put together this year was our nutrition and physical activity community action team. You may see some of the updates in our board narratives moving forward, but we got our programming going, things that we're working on right now. 5Ks to kind of include nutrition and physical activity. So we're working on getting some events going to get the county and community moving through physical and nutritional health. And then we're also working with the school district and maternal and child health to get a program going for 6th through 12th graders to kind of get physical activity going as well too. And then with that, we also are working with our YMCA. I know they're new partners with the county, but we're just starting to get some more relationships built to get more programming going for physical fitness. They were also at the senior fair a couple weeks ago promoting their activities as well, which was good. I'll have you keep scrolling. I'll have you pause at the prevention walk if you want to scroll up. This is probably one of our top 2 or top 3 biggest events that public health also puts together. Every year we have over 100 attendees. We're working on this as well. It's a great way to show how supportive and caring the county is with the outreach that public health is doing. We like to kind of promote our mental health therapists, health and human services, and other support groups at this event to raise awareness and then show support for our community members. And then working with underserved populations, scroll down just a little bit more. There you go. A couple years ago, you may have been aware that we got the public health vending machine grant. In here, you'll see Narcan, fentanyl test strips, and then we also like to include self-care items as well. Initially, the vending machine was just supposed to have Narcan and fentanyl test strips, but we're always trying to do more for our county and community. So we wanted to put in some self-care items as well too. So when you visit, you may see some items in there. They're always free for the community and the public from 8 to 4:30. That's just with our hours at Health and Human Services. It's located in our lobby there.
Supervisor Hickathur.
Cody, looking forward, is Narcan going to be available?
Yep. Yes. So even though our grant ended for the public health vending machine, we're still a part of the Narcan direct program through the state, through DHS. So we're able to order through there for free to get those in our vending machine.
Cody, what about the funding on the rest of the materials you have in the machine? Are they still funded?
Yep. Yeah. So we rely heavily on some of our state funding with the infrastructure grant. We have a couple of years left through that. And then we recently held a penny war with Health and Human Services. So we're able to raise funds for self-care products in the vending machine too. And then we do receive donations and other little grants here and there that we save for some extra funds for the vending machine.
Has there ever been any thought about putting another vending machine like here in this building or in the sheriff's office?
I know a lot of counties have, so there's outdoor vending machines and there's indoor vending machines. And I know some sister counties of ours have a couple throughout their county. We've had discussions about maybe the community center, but there are possibilities to apply for future vending machines in the future. And I'm open to ideas and locations as well.
Supervisor Pease?
I know, St. Mary's has theirs right going into the ER area there.
Yes.
And so it'd be open 24 and it's always under constant supervision.
That's what
Just
I
for-
was thinking.
It might be a possible conversation we could have with Amplify Health or something to partner and do something like that in the future.
Sounds like a good idea.
I'll write that down.
Okay,
Here's a snapshot of our public health team. Even though we are a level 3, which is the highest you can go for a health department, each individual is doing a lot of work. I wanted to give some credit for my team putting this annual report together too. Probably doing 20 jobs per person, just a lot of outreach and vaccination efforts, especially coming out of COVID. So I wanted to thank them as well. And then a few goals that we have moving forward. We want to continue to enhance our vaccination campaigns, maintain and improve our community health improvement plan, resources and outreach. And we're always looking to improve and do more work for the county and the community when capacity allows. So
are there any other questions from members here? Teresa, you need anything answered?
No, I'm good. Thank you.
I did just have one last pitch with the QR code on your bottom right. We just got funding for our public health newsletter. We collaborate with Health and Human Services on getting division education outreach on there too. And we just started this in December. Now we have almost 500 people signed up. So the more we can raise awareness, we can get more information out to community members. So with our population, we're finding this is a good way to communicate clinics, outreach, events going on. So I'm always just educating and trying to promote for that as well too.
What about those that can't use a QR code?
We also have links on our websites as well, and we're more than happy to help sign someone up.
There's several. Supervisor Pease.
Cody, please promote your community outreach for tomorrow night.
Yes, so this has been in the works for a while. We were lucky enough to get a public health intern in the winter, which allowed a little bit more capacity. So we have a women's night out and a kids day and a reality, but there isn't anything for men. It's not exclusive to just men. Their partners are welcome as well. But with our data and the prevention rates for suicide and mental health, a lot of it showcases men being 50 or older with mental wellness concerns. So our public health team and Health and Human Services wanted to do more to kind of promote support groups, recreation, outdoor groups, things that Adams County has to offer to kind of reduce, mental health concerns with individuals. So we have a free event tomorrow from 5 to 6:30 at the school district. Free food, free grill kit for the first 100 people to come in. Everything has been funded through an infrastructure grant through public health. And it's a great way. We have a public health speaker coming in talking about actually a mental health psychologist talking about mental health, which will be really good too. And then there'll be a raffle drawing after, as each booth is free, but we require them to donate a basket to kind of bring in some more people too. But it's just a good way to raise awareness of all the services and support groups that are in the county to let people know what is out there. We get a lot of questions on, I didn't know that this was here or this was there. So this would be a good way to kind of showcase that.
Very good. I wish you luck.
Thank you.
Gentlemen, I think you're all going. Okay. Any other questions for Cody? Okay,
Thank you.
moving on. Director's report, manager narratives. Yes, Kelly.
Can we go back to the
What?
resolution for Rachel?
Oh, okay, sorry. Yes.
Resolution to recognize Rachel Stedman for 7 years of service to Adams County.
Motion made by Supervisor Hickler. Second by Supervisor Pease to forward this on to the county board. Is there any discussion? All in favor?
Aye.
Opposed? Motion carried. Thank you. Okay, now we'll go on to Kelly.
All right, thanks. Our narrative is in the board packet. I thought, before we talk about that, it might be nice to get an update from Donna about how the senior fair went. Because just like men's night, senior fair is a big event. if that's
Yes.
Okay.
So we held our senior fair on May 21st. And it's just ran by the Aging and Disability Services staff. We were able to get 40 plus vendors in, and we had over 200 participants. We did get donations for the brats and all the condiments, so that actually we were able to sell some of those and raise money for our nutrition program. So that was actually good too. The goal of the senior fair was actually to bring in people to show and educate on the activities of Adams County for seniors, including volunteer opportunities. So we were able to put balloons on tables, vendors' tables that actually use volunteers. So people could go right to or avoid the tables with balloons on them. But so they were actually very excited to just be able to see who they could volunteer for, and the vendors and organizations really liked the idea of being singled out that way as well. It was a really rainy day, very cold. And so we ended up putting all the vendors inside. Normally we'd have a lot of them outside. And so I thought there'd be some concerns with that, but the vendors and participants were actually very happy to be squeezed together inside. There was a lot of networking going on, and it was a really great opportunity for everybody to meet one another and see what other resources were here in the county. So it was a really successful day, and we were really happy. And a lot of thanks to the Sheriff's Department, County Market, Ace Hardware, Quick Trip, and our Health and Human Services Department teams, divisions who helped support us.
Thank you. Does anyone have any questions? Congrats on another successful event.
Thank you.
Okay.
Back to the narrative. One thing I thought I would touch on was, it's also in the project status report. So maybe doing those two things at the same time was, really struggling to fill our aging, ADRC supervisor position. So, that division is going to need to look at contracting for dementia care services, so that we are in compliance with our contract. Hoping that we can tap into another county for some resources right now. So I thought that was important to just make sure we highlight. The other thing to highlight is with Rachel's retirement, we are holding that position currently. We don't know what the federal reconciliation is going to look like. And until we know what that impact may or may not be, we're going to hold that position. And that was agreed upon within the capital consortium as well, is that it was okay to hold. I don't know if anybody had any questions about the narrative.
Supervisor
On the
Hickler.
director's report? Just one. Do you know who's on the GOAT committee? And I don't mean greatest of all time. Do you know who that is? How big that committee is? I mean, could be called Doge, but
Go ahead.
Madam Chair.
do
Um,
you know how many?
I did look into it when I first got the request. I believe there's about 7 assembly people on it. The majority were Republican. There were only a few Democrats. I know Representative Swartwell is the vice chair, and he's the person who sent the open records request. I also know that this is a new committee that was just formed in January.
Thanks. I have one other question.
Go ahead.
That's my last one, though. It's gonna be my last one. Where do the EBT funds come from? I mean, the state, but is it federal funding coming through the state?
So the best answer is it depends. A lot of our funding is braided, so it would depend on the program. It's specific to that. That's
Some are directly from Fed, some are direct.
directly to this. It can be the federal money to the state, and then
And
the state determines how to allocate it from there. or it can be federal straight to
Are those
county.
funds potentially endangered?
I would say right now, we just don't know.
Just curious. Thanks.
Supervisor Pease.
Actually, I remember the question I was gonna ask Cody, so going back to public health. Recently, our former county board member has put legislation, trying to get legislation through our EpiPens. And I see Rome looks like they're already carrying them. Where do you think that funding will come? Will it come through public health? Will it come through right to the sheriff's department? I believe it should be public health because eventually they'll have expiration dates. So I'll have to turn them in and switch them out. Any idea what that legislation looks like?
Not aware of any funding right now, but it might be something I could explore in one of my other grants to kind of help aid in getting some of those out in the county. But I do know with my American Heart Association instructor certification, I do give those trainings with EpiPens, so I could see if they'll allow to give us some more for the county for those entities.
You know, you might have to call the sheriff and see if he's supportive of that. I'm assuming he would be, but I'm just wondering if it's gonna eventually be a requirement or if it's gonna be put on each sheriff's department or town department. There's a lot of questions, but I think that's gonna be coming down the line quicker than we think.
Okay, Kelly, excuse me. Along with the goat question, how much time was spent by your staff accumulating all of this data?
A excessive amount. Just even pulling all the information together and giving Corporation Counsel a short answer took a couple hours. I mean, it's just a lot. Our fiscal manager went through every single grant and contract, every addendum, and it went back to 2019. So there was a
Mhm.
lot of information. We went through trainings that we provided. We searched trainings that had a transcription for those words. It was a significant
Considerable.
amount of time.
Okay,
But I believe it was thorough. It was to the best of our ability, but it was
yeah.
it was a very heavy lift for a lot of our staff, a lot of our managers. It was a lot. It was stressful. I would say it was also stressful.
And in addition to everything else they are required to do. Yeah. Supervisor Pease?
My question about that would be is, how come this one have been handled like a Freedom of Information Act where if it required so much time and so much energy and so much paperwork that we would charge back to the state what the stuff they're looking for because we meet all the requirements when they ask for certain materials. Why can they ask for more without any bill or anything else? You would think that you could handle like a Freedom of Information Act and get some payback for our staff time and materials.
Nancy, you have an answer?
Thank you, Madam Chair. Right now, our county does not have an ordinance allowing us to charge for open records requests. I have drafted one, and it's being reviewed. But I can also tell you that this request was also made under, I believe it's Chapter 14 of the statutes, which specifically says that a county shall make its books, records, et cetera, available to the state legislature, and that we're to cooperate with them. I fought this pretty hard because it irked me. As Kelly said, it took a lot of time. And my philosophy was, if you want to change how money is spent in the future, that's your prerogative. But why are we looking back all these years? The money that's spent is spent. We can't get it back. What I was told by Andy Phillips is that he met with the committee twice, by the way, on behalf of the WCA, to try to broker an agreement, but the committee was pretty firm. But what they told him is what they're really looking for is to see if state funds were misspent But if they made a request to the state, they thought that it might be fought, or there might be some hesitancy. And so they decided to make the request to all of the counties instead.
And this wasn't just Health and Human Services, it was countywide departments.
It was countywide, but I emailed all of the department heads and I only heard back from a couple. I think the one that comes to mind is child support, and any DEI training they did was mandated and put on by the state. So there really wasn't much outside of
Okay,
HHS.
thank you. Any other questions?
Kelly, we talked last month, I think, about profitability at Practical Sense. Is that improved?
They are continuing to look at staffing. They've been short-staffed. We did interviews last week and have a really good candidate that we're hoping to get in quickly. Because that is a busy place, and some are super busy, especially with donations, because there are so many rummage sales throughout the summer. So usually the Monday after rummage sale weekends, the store is overrun with donations, which is wonderful. So yes, they're hoping to get their Facebook page up and a little more active, as well as keeping the shelves stocked. But they are working to bring in more profitability, as well as looking to bring in more clients through our CCS program, because that is a major way for them to generate revenue also.
Are there any other questions? Were there any questions on the financial report? Okay. Hearing none, we will have Supervisor, or excuse me, Donna Richards report again on the Aging Advisory Committee.
So the Aging ADRC Advisory Committee met on May 28th at the community center. We discussed the program review for March and April. Further information was added on the Wisconsin Farmers Market Nutrition Program, with vouchers now available as of June 1st. We also had a report from the Nutrition Committee. Their next meeting is June 20th. Report from Transportation Committee. Their next meeting is on June 10th. We also discussed the 2025-2027 aging plan goals, which were reviewed and looked at the progress on that. The 2025-2026 ADRC marketing plan was also discussed. We identified the purpose, roles, and goals for that plan. Report on the Advocacy Day that took place on the 13th at the state capitol. We had 6 Adams County residents participate, and the asks included in the state budget were for the funding for the ADRC, home delivered meal programs, fall prevention, caregiver support, and specialized transportation. Majority of those were already removed from the budget, but we're going to continue to ask at this point. The report from Senior Fair, I already gave you that. And so that's what we talked about. And the next meeting is July 16th at 1 o'clock at the community center.
Any questions from the committee? Okay, anything further to come before this committee? Our next meeting is July 14th at 4 p.m. There's nothing else. This meeting is adjourned. And thank you all. And gentlemen, I do hope